Is it actually possible to do things to prevent cancer?
Absolutely. There are many things that women can do to prevent breast cancer. There are some obvious ones like not smoking. Smoking, most people know, is a risk factor for lung cancer, but it's also a risk factor for breast cancer. Women should try to minimize their alcohol intake. And the studies actually show that your risk increases with the number of drinks that you have each day. The Department of
Each
Health,
day?
each day, yes,
Okay.
yes,
Okay. I
each
was
day.
going to say to you, all right. So should you be having a drink every day or?
So it depends on who you ask, but the most recent guidelines from the Department of Health and Human Services would recommend only one per day. Uh, but the
Okay.
yeah, but the American Cancer Society says try to eliminate altogether.
All together.
Altogether.
Wow. Okay. I hadn't heard that one. Okay.
So
Okay.
maintain a healthy weight. So
Mm.
obesity is a risk factor for breast cancer. And why is that? Most breast cancer feeds off of estrogen, which is the female hormone, and fat cells make estrogen. And so by minimizing the amount of fat cells you have in your body, most women have a decreased risk of breast cancer.
So when a woman has a history of breast cancer, does it really matter if she takes those preventative steps?
It still does.
Okay.
So, for example, if a woman has a strong family history of breast cancer, she doesn't want to compound that risk by also having risk factors like excessive alcohol intake or obesity. And by the way, those recommendations to not smoke, minimize alcohol intake, maintain a healthy weight, they're good for your overall state of wellness regardless.
Sure. And at what age should a woman start paying attention to her breast cancer risk?
I would recommend between the ages of 25 and 30 years old. And at that time, a woman should take a step back and evaluate her personal risk. Does she have a family history of breast cancer? Does she smoke? Is she starting to have a glass of wine every night with dinner? So assess her personal risk and then also start to maintain what we call breast awareness. We're not recommending that women do regular breast exams anymore, but we should all certainly stay aware of how things look and feel. And if there's a change, then it should be brought to the attention of your doctor.
Women aren't supposed to do self breast exams anymore?
So the new phrase is breast self-awareness. And the reason the recommendations have steered away from the regular breast exam is that women were finding a lot of benign lumps and bumps that ended up warranting biopsies and even surgeries. But again, we have to temper that new recommendation with the idea that we still want women to stay aware of how things look and feel.
Okay. So a lot of women think one way that they are preventing breast cancer is they have their mammogram, right? So is that true?
So mammograms don't prevent breast cancer. They just hopefully catch it early when it's easier to treat.
Okay, got it. All right. So one thing I can start doing today to decrease my risk of breast cancer.
Yeah. So eat a lean dinner, skip the glass of wine, and go for a gorgeous walk on one of these autumn nights.
That's fantastic. I love that. That's great. Thank you so much. Such great information.
You're welcome, Marianne. Thank you.